Hi, in this video I'll give you a quick run through of the naloxone medication Prenoxad. Prenoxad is an intramuscular injectable form of naloxone, which is the medicine that works to reverse the effects of an opioid overdose. Firstly, if you think someone has overdosed, call emergency services prior to administering the Prenoxad, noting that it will only work on an opioid overdose. It will not work on other sedatives like benzodiazepines and or alcohol. Remove the clear film wrapping by pulling the red strip at the side of the box and gently twist to open. Inside you'll find a syringe and two 23 gauge needles. The syringe has 5 doses, each marked by a black line. Next you'll need to assemble the syringe by taking off the black lid, opening up the needle packet and, whilst keeping it on the sheath, twist it on clockwise and then remove the sheath. Prenoxad is injected into muscle. Do not inject it into the person's veins. We recommend injecting into the top of the leg, the buttock, or the muscle in the upper arm. Hold the barrel of the syringe as if it were a pen or dart. Pinch the muscle and insert the needle directly at 90 degrees. It's not necessary to remove clothing, but it might take a little bit of extra force to push the needle through. Administer 1 to 2 doses, then withdraw the syringe and place it back inside the yellow packet in case you need to give a second or third dose. Next, if you feel confident, conduct CPR. Place the person on their side into the recovery position and monitor their breathing. If they don't become responsive within 2 to 3 minutes or 4 minutes if pregnant, take out the syringe and repeat the procedure, administering another 1 to 2 doses, and then repeat CPR or place the person back into the recovery position. If and or when the person comes around, it's really important you reassure them that they're okay and wait with them as long as possible and at least until emergency services arrive. It's also really important that you encourage them not to use again for a few hours, even if they feel like they're in withdrawal, as the naloxone will wear off within 30 to 90 minutes and they may drop again. Stay with them and reiterate this message for as long as possible. Lastly, make sure you restock your supply of naloxone as soon as possible in case you need it again in the future.